We know that smoke-free air laws and policies protect non-smokers. The smoke that comes off the tip of the cigarette has a lot, if not all, of the same cancer-causing chemicals that mainstream smoke does, the smoke that the smoker inhales. It's just that when they're diffusing it into the air, the non-smoker doesn't breathe them at the same concentration. That said, some of the cancer-causing chemicals in secondhand smoke are actually far more concentrated than they are in mainstream smoke, and that includes, for example, tobacco-specific nitrosamines. So that some have estimated that the risk of lung cancer for a bartender after an 8-hour shift in the bar is the same as if he had smoked 5 or 6 cigarettes, which is not insubstantial. What's extremely interesting is the studies that have been done in communities that have gone smoke-free. And what they're finding is that admissions to emergency rooms for heart attacks and now for respiratory distress go down after the smoke-free laws are passed. Not just in smokers, but in non-smokers. So it's quite compelling. This is quite compelling supportive evidence of what we've seen in the case control and cohort studies. One other component to the secondhand smoke issue is that we know that we've made good progress, but there are still way too many young people and adults in this country who are exposed. There are still a substantial proportion of households that allow smoking, and there are a substantial portion of states that don't have laws prohibiting smoking, for example, in private workplaces or in restaurants or bars. And we hope that as knowledge continues that we'll get 100% coverage in our country, like many countries around the world have. We also know that the simple separation of smokers or cleaning systems or increased ventilation does not eliminate the problem. The only thing that eliminates the problem is source control. And that means that people have to take it outside, that there be no smoking inside a building.